Hi friends, I'm Dr. Suraj Chiraniya, hemato-oncologist and bone marrow transplant physician in Mumbai. Recently, I have seen one patient, 24-year-old young male, presented with the complaint of swelling over the neck and axilla region, means armpit region, since 3 months. It was associated with fever on and off, weight loss of around 10 pounds, and night sweat. So, as the symptoms pointing towards the B symptoms and weight loss, fever, so we went ahead with the lymph node biopsy of the cervical area, and it showed CD30 positive and ALK positive anaplastic large T cell lymphoma. So today we will discuss what is this anaplastic large T cell lymphoma. It is one type of aggressive, rapidly growing cancerous disorder of special cells. We called it as a T lymphocytes. T lymphocytes are the cells that are liable to kill the foreign material exposed in the body, as well as any infection that is body is exposed. This is one type of non-Hodgkin lymphoma, and mostly it is a cancer of white blood cells. So second point, what are the causes of anaplastic large T cell lymphoma? So usually there are no causative agents found, but it is most common in the young age group. There is no radiation, there is no chemical exposure leads to this problem, and there is no contributory family history as well. Then signs and symptoms of this anaplastic large T cell lymphoma. The most common symptoms is the painless swelling over the neck, axilla, and the groin areas that increases in recent times. Second, fever that is ongoing, that temporarily subside by giving the medicines. Third, weight loss, unintentional weight loss more than 10%. Fourth is night sweats, patient having a severe sweating in the night. Fifth symptoms are fatigue. Patient will have a persistent fatigue even after taking the enough rest. Seventh is the skin lesion. Patient can have a purpuric eruptions over the skin. How you will diagnose these T cell lymphomas? So for diagnosis, we will need to do the physical examination that showed lymph nodes in the various part of our body. Second, doing a blood biochemistry to know the overall health of the patients and the renal and kidney function. Third is PET scan to know the staging of the disease, means where all the disease has spread. Usually staging is divided into four categories. Stage 1 means it's localized to one area of the body. Stage 2, two and more areas but affected on the same side of diaphragm. Third is 2 to 3 areas but on the opposite side of the diaphragm. Fourth, on the distant areas like liver, lungs, kidney, it has, and bone marrow, it has spread. Fourth, for diagnosis is the most important, lymph node biopsy. So we need to take a excisional or the core biopsy, and we check for the various immunohistochemical markers. Usually CD30 and ALK, these are the two markers we test during the diagnosis of this problem. CD30 is usually positive, and on the basis of ALK, these are divided into the ALK positive anaplastic large T cell lymphoma or ALK negative anaplastic large cell lymphoma. Fifth test, sometimes we do a bone marrow test to know the disease has spread to a bone marrow or not. So once we know the age, staging, and overall the risk category of the patient, we give patients different treatment options. These we will discuss right now. First is chemotherapy. Chemotherapy is the traditional approach. Less than 60 years we give GOP chemotherapy, and more than 60 years we give CHOP chemotherapy. Second is immunotherapy options. Currently, brentuximab has changed the overall prognosis of anaplastic large T cell lymphoma because these are CD30 positive, and brentuximab attacks the CD30 positive cells. So brentuximab can be combined with the above chemo regimens to have a more better enhancement of the effect. Third, in aggressive and recurrent diseases, we can give the options like autologous stem cell transplant and allogenic stem cell transplant. So conclusion of this case was, it's anaplastic large T cell lymphoma is an aggressive disease mostly common in young patients. It can be easily diagnosed and categorized according to the list category. There are effective treatment options are available, including chemo and immunotherapy, but has to be started as early as possible. For further personalized treatment, please consult your hemato-oncologist, and for further updates, stay tuned, stay informed. Thank you.